Good evening or afternoon, depending on which time zone you're in. And welcome to the Myositis Association webinar, Bridging Experience and Expertise, Myositis Patients as Healthcare Providers. So with this evening, we're going to get a chance to talk with all of you and among each other from the perspective of healthcare providers who also have myositis. But before we begin, Rachel has some housekeeping details for us. And so Rachel, if you'd go ahead.
Absolutely. One moment. Let me share my screen. All right. Thank you so much, Dr. P. We appreciate you moderating today's panel, and we appreciate all our experienced panelists on today. We want the audience to know that they can find all of our resources and other information at our website, myositis.org. And before we get started, TMA does not give medical advice. We do share what has and hasn't worked for ourselves, but of course, we encourage everyone to make healthcare decisions in partnership with their own healthcare team. This webinar is being recorded and will be available on TMA's YouTube channel next month. Please put any questions you have in the Q&A box that is in your toolbar. The chat box is for you guys to let us know where you're tuning in from and to talk to each other. But if you have a question for any of the panelists, please put it in the Q&A box or it might be missed. If you pre-submitted your questions when you registered, we have someone on hand that is loading those into the Q&A, so there is no need for you to submit again. Questions that do not pertain specifically to this webinar may be answered in future programming, and please let us know where you are joining us from. I am broadcasting from Ellicott City, Maryland. I also have a call to action here. Please ask your representative to co-sponsor House Resolution 277, making May Myositis Awareness Month. Even though May is almost over, we still have time to make this happen, and we appreciate you going to that link. We will put that link in the chat, not right away, but in a little bit. And then, of course, we absolutely appreciate if you are able to make a donation, no matter what amount. We are raising funds during the month of Myositis Awareness so we can continue our amazing and critical programs. So with that, it's back to you, Dr. P.
Thank you very much, Rachel. And I've got to already apologize. I said good evening or good afternoon, and I saw there's somebody calling in from Australia. So that's thrown the whole thing off as far as my greeting. So welcome to everybody, including our international partners. Great to see the range of places where people are from. That's absolutely terrific. I'm Peter Winkelstein. I am a physician, a pediatrician. I have IBM. I was diagnosed about 8 years ago, and I help facilitate the upstate New York support group. I'm located in Buffalo, New York. What I'm going to do is I'm going to ask each of our panelists to introduce themselves. There'll be a little blurb on the screen, just like the one you're seeing for me. But I've also asked the panelists to tell us where they're located, tell us what part of the healthcare field they're in, which kind of myositis they have. All of our panelists and me, the moderator, have myositis. And then please to tell us one fun fact about yourself. And so I promised that I would give a fun fact about myself to break the ice on that one. And so the best one I could come up with quickly was that I used to do a lot of sailing. Unfortunately, the IBM is at the point where I can't get on a boat any longer. So I have shifted over and I do radio-controlled sailing, where I get to use my thumbs to do the sailing. And that has actually been tremendously helpful to me to keep me involved in a hobby that I love. And so with that, I'm going to go through the panelists in alphabetical order. I should mention that one of our panelists was unable to attend this evening, and so she was having some personal issues, and we wish her the best. So I'm going to start with Renee. Renee, please introduce yourself.
Hi, everyone. Thanks for joining us from all over the world. My name is Renee Lantner. As you can see, I am was an allergist. I recently retired from the specialty of allergy, asthma, and immunology. I live in a suburb of Chicago called Western Springs that no one's heard of. My story is I was officially diagnosed with dermatomyositis in 2008, and I'm on medications doing well. But I actually had severe myositis in early 1990 that was not diagnosed. And I ended up with severe muscle loss, severe weakness. And for some reason that nobody can really understand, I went into remission for 19 years without any treatment. Um, my fun fact is that when I knew I was going to be retiring, I decided to try to pick up some volunteering opportunities. So I have volunteered with our local forest preserve, and I got involved with what's called a calling frog survey, which means that we had to learn on a 3-hour Zoom call to identify 13 types of frog calls. Luckily for me, most of them are not in my area because that's a lot to remember. But it's really interesting, and I've gone out to do my exploring and listening and counting them by sound. Um, and I also know that I'm supposed to at some point talk about how healthcare affected my myositis journey. I do want to ask Dr. P if I'm supposed to do that now, or would you like me to do it later?
Why do you hold that one? Because that's
Okay,
very apropos for the next question. But yes, very
gotcha.
much looking forward to hearing your perspective on that one. Thank you. Great. Thank you, Renee. So, Jim Matthews.
Hi, I'm Jim Matthews. I'm a retired pharmacist and live in Grand Haven, Michigan, on the shores of Lake Michigan, across the lake from Renee. Uh, and I have IBM, and I was actually diagnosed just 10 years ago, but 20 years ago, my liver enzymes went up. And other than my doctor claiming that I shouldn't be drinking as much, um, and there's actually a story behind that too. He and I were in pharmacy school together. He went on to med school. So he had a different perspective maybe on my potential drinking. But that really wasn't it. And then 5 years after that, I started noticing physical symptoms, which that same doctor said, well, hey, we're not getting any younger. And I can't do everything I used to be able to do too, which I think was medical speak for just shut up and quit whining. Um, but I did finally get diagnosed with a new doctor, and got diagnosed within a couple of weeks. The manual muscle testing lab draw uh, gave them a pretty good diagnosis, but we did have a muscle biopsy as well. So, and I spent a little time on the TMA's board of directors and started a IBM, one of the couple in the country, specific IBM support groups in West Michigan. Anything else, Peter?
Did you give us your fun fact?
Oh, my fun fact. Yeah, my fun fact is as soon as all my grandkids become of voting age, I should have no trouble becoming the mayor of Grand Haven. I have I have 16 grandchildren, 6 kids, 16 grandchildren, and I'm very fortunate that almost all of them live in the area. So.
Congratulations. That's terrific. Absolutely fantastic. Thank you. Next is Jim Maloney.
Hey everyone. Good evening, good afternoon. Um, my name is Jim Milani. I'm a physical therapist. I live in Colorado. I was diagnosed in October of 2023 with IBM after about 10 years of interesting blood work and symptoms and a number of falls over that course. I continue to practice physical therapy. I'm a geriatric specialist, and I also work corporately as a clinical operations specialist. Um, a couple fun facts, or one fun fact, I guess. I'm from southwestern Pennsylvania, Latrobe, Pennsylvania specifically, which is the hometown of Arnie Palmer, Mr. Rogers, Rolling Rock Beer, Banana Splits, and the true birthplace of professional football. So if you're here from Canton, Ohio, I'm sorry I pulled the rug out from under you.
Thank you. And we'll let the football people argue over the details there on that one. So appreciate that one, Jim. Barbara.
Hi there. So I'm Barbara Shaw, and I am a family nurse practitioner and on the faculty of Rush University College of Nursing here in Chicago, where I live. Good Midwestern representation on this panel. I've been living with antisynthetase syndrome slash dermatomyositis for quite a while. I think it took quite a while to get diagnosed. So there were 3 or 4 years where I was quite symptomatic, but nobody could figure it out. And fun fact is that I am a factory owner. What kind of factory, you might be wondering? I own an earthworm factory because I am a fanatic gardener, and earthworms are the best. And so I've got like thousands of them growing and reproducing outside. That's it.
I had no idea that earthworms were manufactured in factories.
Yeah, well, they're not manufactured. Well, they have their families in factories, in this little factory I have for them.
That's a great fact. Thank you, Barbara. It's an interesting image, the earthworms in the factory. Okay, I gotta process that one. Thank you. Jen.
Hello, everybody. I'm Jen Swisher. I am practicing emergency medicine PA as well as full-time faculty at a local PA program here in Southern California, Newport Beach, California, specifically. I'm the mom of 3 little girls, ages 3 to 10, and married to a local firefighter. I was diagnosed officially with dermatomyositis it'll be 3 years this summer, but we think my symptoms probably went back 2 years prior to that for a total of 5 years. And I specifically have the TIF1 gamma variant. And my fun fact is that I was on Wheel of Fortune when I was in college. So that was pretty fun as a contestant. Yeah.
Terrific. How'd you do?
I didn't win. I got all the way to the end, but it did give me a decent chunk of money because everybody kind of wins if you solve any of the puzzles. So I solved all of the puzzles except for the very last one and was able to help pay for some textbooks in college.
Terrific. Thank you very much. Really appreciate it. Thanks everybody for your introductions. So the first question that I want each of the panelists to give us their thoughts on and their insight into is to tell us a little bit about examples or stories about how being in healthcare influenced your journey, your myositis journey. How did it affect it? How did it help it? How did it get in the way? Being a healthcare provider gives you some insights into the healthcare world. And how did that impact your own understanding of your own myositis? And so I'm asking the panelists to limit their answers to about 5 minutes. And what I'd like to do is I'm going to go in reverse alphabetical order for this one. So Jen, we'll start with you.
Great. So, like I said, I'm relatively new to the diagnosis. And essentially, what happened is back in 2019, I started having some vague symptoms. Was sent to a rheumatologist to get worked up initially. I had a borderline ANA and rheumatoid factor at that point. and was told essentially I was just a mom and that's why I was so tired and having the symptoms that I was having, and kind of dismissed at that point and told, you're a shift worker working in the emergency department, you have two small children, of course you're going to have the symptoms and be tired. And so I kind of took that for what it was, went on in my life. And the funny thing is, I say this, and I think a lot of healthcare providers will understand this, but I'm like, it's like, how do you know you have an autoimmune disorder without having one? You're drug seeking for steroids, right? And so I would just get by putting myself on steroid dose packs to be able to just kind of get out of whatever rut I was in at that point and just survive through that. And it wasn't until I was postpartum and with my third child, she was about 4 or 5 months old, and I was working back after maternity leave, trying to get off of the stool. I was working full time in the emergency department, and I was having a hard time getting off the stool, doing my hair, things like that. And I was like, okay, that's interesting. I just must be fatigued and a little just out of shape from having my third child. And I was having difficulty lifting her car seat into the car, and just different things like that. And I just kind of chalked it up to a lot of things. I also should have mentioned I do have Ehlers-Danlos syndrome type 3 hypermobility. And so a lot of times I end up with joint issues, hypermobility. And so I chalked up a lot of my symptoms to that. That can also coincide with mast cell activation syndrome, which kind of was a good reason for all of the red rashes, right? So there were good reasons for all of my symptoms that everybody kind of dismissed. My right hip was killing me a little bit postpartum, about 6 months in. I went to my orthopedist at that point, knowing I had a labral tear, thinking maybe that had expanded it, in labor or just postpartum. And so I had gotten the MRI at the same time I was seeing a dermatologist for all of these rashes. They thought I had a gluten sensitivity. They were doing all these things, rosacea. They slapped tons of creams on me. Nothing was working. And finally, they went to go take a biopsy because they thought it was some kind of a celiac variant. At that time, I had to backdoor myself into a different rheumatologist and pay cash to see them because nobody would see me without a diagnosis. So they started, there's maybe you have seronegative rheumatoid arthritis since your dad has RA. And so they started running some labs on me, and I was getting the MRI at the same time and biopsies. It's then when, as soon as the MRI came back showing a stable labral tear and it showed diffuse myositis, that I put 2 and 2 together, called the rheumatologist and asked them to add on a myositis panel because I thought I had dermatomyositis. And he said, there's no way, that's too rare. You're young, you're able to kind of function. That's not probably what it is. I said, that's fine, humor me. The 2 days later, the biopsies came back with interface changes. And 7 days after that, the rheumatologist called me back in a panic, going, I need you to call me back right away and discuss the results. And that's when TIF1 had come back positive. And at that point, even now with the diagnosis, it was going to take me 6 to 9 months to get in to see a rheumatologist. So I backdoored myself and texted through our chat that we have at our hospital to a rheumatologist that a friend had recommended. And I say, look, I've never done this before. But I have 3 little kids. I'm working full time and I can't even get off the stool at work. Like, I need to get seen right away. So I was able to get myself in to see her. She goes, no problem. I'll see you next week. And lo and behold, I was very lucky that she's actually, her best friend in fellowship was the chair of UCLA's Myositis Center. And so she was able to get me in, get me treated, and get a very good, and actually expedite me into a myositis center, which is probably the thing I recommend the most to patients when we're asking, like, what do we recommend, is just, I know that it's difficult and whether it's telemedicine, but to get hooked up with a myositis center that really knows how to treat this, because the rheumatologist I initially saw had admitted I was the second DM patient she had seen. And so she wasn't familiar with it. Her initial treatment plan wasn't as aggressive as the myositis center. And there's been a lot of things they've kind of disagreed upon, but worked together with. And so that's been a huge game changer for me. 2 years into my diagnosis, I tore my ACL and started seeing a physical therapist. Shout out to Jim. So not him, but it was actually them who actually knew a little bit about myositis, who had recommended fast twitch muscle exercises, which actually helped with my rehabilitation and the muscle atrophy so much faster than anything else could. So that's the other recommendation I would have, is get into PT if you're able to. And those fast twitch exercises really do help a lot. And then just
And I'm going
advocate.
to ask you to ask you to wrap up. Yep.
Yep. So perfect. And then my last big thing I was able to advocate for is typically I'm on one of my regimens is IVIG, and it's usually 3 to 4 days in a row. And that's not really good with my schedule of 3 little children. So I was able to advocate for myself and get on a schedule where it's once a week throughout the month. And so those would be my big three recommendations.
Terrific. Thank you very much.
Thank you.
Yeah, self-diagnosis story. That's a heck of a story. Yeah, good for you.
Thank you.
Uh, Barbara, I'm going to ask you to talk to us a little bit about your experience and what it's been like being a healthcare provider with myositis and how that's affected your journey.
Sure. I think, like probably for a lot of us, I felt very dismissed about the symptoms I was having for a long time. I had a terrible cough that would come and go, and the providers I saw just kept saying, it's asthma, it's asthma, it's asthma. And I was like, it's not asthma. And it wasn't until I've lived with this for 7 years, but it wasn't until I was okay. And then I was very much not okay, losing weight, night sweats, trouble swallowing, couldn't walk hardly, that all of a sudden it became really urgent for me to get looked at. And that's when I started the path towards being diagnosed. But that even took a while. And it took a while for people to take those symptoms seriously. It's not like I was trying to lose weight. And yeah, I was trying to do these things, but I felt that I was kind of put in a spot where I had to justify why I was pushing them to look for something else. And I had seen my primary care provider finally when things had gotten really, really bad. And I said to her, something's really wrong. I don't know what it is, but it's really wrong. And my heart's beating out of my chest. And could you just do me a solid and run an EKG? And she came back into the room, white as a ghost, and said, you need to go to the ER right now. And that's when the whole thing started. And that's when I ended up seeing rheumatologists. I started at one academic medical center here. And I unfortunately, because there were so many problems with communication, I ended up I hate using this word, but yeah, I fired them and looked for another site where I was actually seen by both a pulmonologist and a rheumatologist at the same time, which was amazing. So I think these centers of excellence are really important to get you on the right track. So by the time all this happened, I had lost 50% of lung function and I was kind of wasting away and was finally put on the right medication. But I have to say that to me, not only was it a total eye opener about, what I knew was already wrong with the healthcare system kind of slapped me in the face. It's like, yeah, this is really bad. And if I am having this much trouble, I'm just thinking about the patients that I've seen and how difficult it must be for them. And just thinking about that a lot, thinking that I'm kind of coming from a place of relative privilege, but it made me very upset about what's going on in general. And it made me really feel like that's what I want to. I want to be somebody who patients can talk to and be taken seriously by.
Thank you. That's yeah, and I think I think that that's a unfortunately common complaint from patients is how difficult it is to find the right person and get in at the right to the right people. Any Barbara, do you have any advice? For us in the field, we kind of know who to call, right? Or know somebody who knows somebody to call. What do you do if you're not in the field?
Well, that's the thing, right? It's really hard. I thought that I knew how to maneuver in a system, but it ended up that I felt, especially at one academic medical center that I was in, that I just kept bumping into these big walls. It wasn't until I looked online, when I finally had the energy to call around, I called around. It was hard to get an appointment at the place that I decided would be the best fit for me because of this. As I said, they had a center and you'd actually see these subspecialists together in the same room with you, which was mind-blowingly wonderful. But I think looking to TMA, for instance, looking for specialists who are listed and centers of excellence that are listed is the way to go. But it takes a huge amount of energy, especially at a time when you don't have that energy. You don't have that get up and go. I didn't, to like be looking and searching through Dr. Google like for hours and hours at a time. So I think it's really hard. But if you look for centers of excellence, look for the Myositis Association and what's available through this organization, I think those are ways to go.
Terrific. Thank you. Thank you for that. I think that's very helpful. And yeah, I agree. The shout out to the Myositis Association for having the tools. I saw Paula mention the Find a Doc tool and the resources that are on there. Please, please make sure if you haven't already that you're looking at the Myositis Association website and resources. So thank you. Next, Jim Milani to address this question of your experience as a healthcare provider and how that affected your myositis experiences and journey.
Thanks, Jim. I'm thinking about this maybe a little differently. And when I think about like the past 30 years of providing care as a therapist to a wide variety of patients with varying injuries, illnesses, and conditions. And I'm thinking about like how that has really shaped my myositis journey. And I have to say, and there are a couple things that in that relationship that have impacted that journey in a positive way. But I would probably say the biggest positive impact has been those patients, because I feel like I've learned from their experiences. Even though I'm in healthcare, I kind of see real time how individuals have to advocate for themselves many times. And I would also say the patients that I see, there's specific characteristics or traits that kind of align with regard to the success that they have in terms of managing whatever their illness, injury, condition is. And I would probably say that in those situations, those are things that are kind of learned behaviors over time. And one of the biggest factors I think that's really helped me is this idea of control. And the patients that I always have felt that navigate the system the best are the ones that understand that their control is around their attitude and their effort. And many times that they can live in the present, and they don't necessarily have to focus on the past or worry about the future. And I've seen that as traits or characteristics that have really made them successful in navigating their disease. And what I mean by that is their quality of life is much greater, despite maybe dealing with significant functional limitations or impairments. I've I've really had a hard time kind of letting go of many of those things, and not living in the moment, and really getting to the point where I know that I have two things that I can control: is my attitude and my effort around this journey, and around taking care of myself for the purpose of having a higher quality of life, despite what that functional limitation might be over time. That's probably the predominant one. Jen, I think, was also, and Renee, I think you both hit on this other point, this idea of, collaboration in healthcare is definitely something that has really helped me in my journey. I know that kind of professionally over 30 years, I've really focused a lot on talking to other providers, whether they're neurologists orthopedists, rheumatologists, but other physical therapists, occupational therapists, and speech therapists. And that collaboration has really taught me that it takes a village to really care for individuals, particularly those of us who are suffering from a degenerative progressive disease that there isn't necessarily a cure or a treatment for. Um, and that is something that I really think as a healthcare provider we see firsthand. And I think as individual patients that are dealing with these kind of disorders, we can really kind of lock arms around the idea that we have to become partners with those people that we're using to provide our care or to give us insight into our care. Um, and ultimately, as a healthcare provider, it's not only helped me kind of manage my own symptoms, my own journey, but it's really also made me, I feel, a much more empathetic and capable clinician for those people that I really care for.
Thank you, Jim. I heard a lot of your learning from your patients, things that help you with your own myositis journey. And I think I think for all of us in healthcare, uh, even not just the myositis stuff, but just in general. I don't know, my experience certainly in my clinical career was I learned a lot from my patients.
Yeah.
Um, and so I'm a pediatrician, so sometimes I learned a lot from a 3-year-old. I mean, it's amazing what they can sometimes teach you. So but no, I appreciate that, and that's something that probably our audience should be aware of is that the person you're working with, your healthcare provider, is learning from you as well, and especially with something that we all have something that's quite rare, and it doesn't take too long for us as patients to know a whole lot more about what we have than many of the people who are taking care of us. And so it really is a two-way learning street. So I really appreciate that. Jim Matthews, I'm going to ask you now to talk about your experiences and how your experience as a healthcare provider informed your experience with myositis.
Uh, yeah, I was actually not working when I was diagnosed. I had retired about a year and a half, maybe 2 years before I was diagnosed, with dreams of traveling and dreams of entering into as many tennis tournaments as I could. And when originally diagnosed, it doesn't hit you all at once. So I was still playing what I call halfway decent tennis, and actually won a small tennis tournament. Now you have to understand that the golden rule in playing doubles tennis is to find a partner who's better than you, younger than you, faster than you. So we formed a good team, and basically I stood up closer to the net and he handled 3/4 of the court. If it went over my head, it was his. So, and we actually won a small tournament right after I had gotten my diagnosis. Probably the interesting thing, though, is as soon as I was diagnosed, I was desperate to find out everything that I could about IBM, and went to my first patient conference, which was down in New Orleans that year. And one of the speakers, well, actually, tell it this way. I was sitting next to the sainted longtime executive director of the TMA, Bob Goldberg. And the talk that was going on at that time, and this was one of my heroes. He just Tom Lloyd, and he's just brilliant. But he hadn't yet learned how to tone his talk down to the general public. And Bob Goldberg, knowing I was a pharmacist, Bob Goldberg leaned over to me and he said, "How much of this are you getting?" And the answer was maybe 60% of it. But because of my background, I was able to research things. I knew where to go. I could dig out the information. So the 60%, and that talk was recorded. And so I was able to go back. And when he said something that was over my head, I could stop the tape and look it up. And I went from 60% to maybe 80%. I listened to it one more time for the third time, being able to stop it. And I think I might have gotten up to 85 or 90%, and that was as far as I was going to go. But I greatly appreciated just my ability to understand most of the principles of IBM. And then, came back and we started a support group. At that time, there was one. It was on the east side of the state. I'm on the west side of Michigan, and it was in the Detroit area. But my wife and I would drive over whenever they had a meeting. And eventually, a couple of years ago, we were able to form a support group on the west side of Michigan. And there were just some people that I had met through Facebook groups and things like that. And actually, to my surprise, when we got together to kind of form this group, they all wanted an IBM specific group. So we did that. And I understood at that time, now maybe there's been one just recently, but there's another IBM specific group in Northern California. And we're the only two as far as I know. So I do lead or co-administer, I should say, a Facebook TMA support group. And, appreciate the fact that I can speak at least reasonably intelligently about the disease. So
Thank you, Jim. I really appreciate that. That's it's a good insight there, and I think that the medical background sometimes helps in absorbing all the information that we want to absorb. So totally agree. So thank you very much. Really appreciate it. And Renee, your thoughts on approaching myositis being a healthcare provider?
Well, first I want to say, as we all know, all of our stories are unique, but we certainly have a lot of things in common, and I would mirror many things that everybody has just said. I'll try to put my spin on it. So my story goes back, as I mentioned earlier, to 1990, and I was 30 years old. I had just had my first daughter. I was an attending physician, again, in the field of allergy and immunology, and I had just taken my boards, during which we have to know about autoimmune diseases. So it was Super Bowl Sunday in January. Some of you have heard the story, perhaps, if you've been to a meeting. And I was throwing my daughter up in the air, and all of a sudden I almost dropped her because my arm stopped working, basically. So that was the beginning of what became a very frustrating journey. So I was in a medical center with rheumatologists, and they had no idea what was wrong with me. My husband, who's a brilliant internist, he actually drew a lab. He got my CPK and my aldolase. He drew my blood at home, and he was the one that sort of said, this something's really wrong. So they initially too, somebody had mentioned elevated liver function tests, which actually can be part of your muscle damage. And so it's like, yeah, you just got the flu, you're fine, you're going to be better. So things did not get better, and I got very wasted. I lost most of my muscle mass in many muscles, and it just kind of burned out, which was very strange. So I was left with very little strength, a lot of contractures. I had to get like manual muscle work, which was not fun. Then it went away for 19 years and I should mention too about being a healthcare provider, not only had I just taken my boards and knew something about it, I kind of had a feeling that's what it was because I had the skin lesions, which are pretty much indicative of the disease, and of course the muscle wasting. And I had an old textbook, this is before the internet, and I had an old textbook that basically said people with dermatomyositis, half of them die in a year, which is of course not true. And I didn't know anything about what antibodies I would have, which were at its infancy back then. And I had this infant daughter, and so I went into a really bad, dark place for quite a long time. But then, it kind of got better. And then 2008, so much more recently, I knew what it was this time. But again, I still had a hard time getting in the right place. And I still remember as people were talking, all these stories are coming back to me because it's been 17 years. But I saw a dermatologist who was highly recommended. She took one look at me. She goes, "Man, you have a lot of skin damage." And it was the rash. And she wanted to do some really strange procedure on me with all the medical students watching. And I politely said, "That's enough. It hurts. I'm leaving." And then I went and saw someone at a different medical center who actually had trained her. And he was so excited because I was like textbook dermatomyositis. And when I told him who I'd seen, he's like, "Oh my gosh, I'm so embarrassed she missed that because I trained her." But he was not great either. He put me on a medication that I had a severe reaction to, and he kept saying, "Nope, you're just in the sun too much." And I had tinted my car, I had tinted windows in our home. I couldn't run anywhere because I couldn't run. I could barely walk, but I was wearing sunscreen, etc. So I'll just make this shorter because according to my thing, I only have a minute and a half left to talk.
Doing
So
fine. Doing fine.
I got my timer on too. Um, so I probably went through at least 10 physicians before I found people who knew what they were doing, were not rude to me. I had a really bad experience with a rheumatologist who all these people knew I was a physician, which shouldn't have made any difference at all. But I had to fire a lot of doctors who were just egotistical. And doctors have egos. I can say this because I'm married to one who's wonderful, but I know doctors have egos, and if they don't know something, they often take it the wrong way and like blame you that, you're just like all the stories. Oh, you like we were hearing from earlier, you're just tired, you have kids. And I got a little bit of that treatment as well because I was only 30 at the time. Um, so it was a frustrating journey for me. I'm in a wonderful group. I did go to Hopkins at some point, and I had already befriended Lisa Christopher Stein, who's a wonderful person. I knew her because I was on the board of directors for the TMA. And so she kind of confirmed what I was doing with the people I was seeing. And I would highly recommend also advocating for yourself, getting out there, questioning what they're doing. And if you can get someone who is in a myositis center, that would be ideal because it is really important. Oh, that's my timer. Sorry. So that's my 5 minutes. So I'll leave it there.
Renee, thank you. Thank you very much for the insights. Really, really appreciate that. We're now going to do a little bit of Q&A from the audience. I've been looking at the Q&A here, and we've got some great questions in there, and we only have 15 minutes. So there's not a chance we're going to be able to answer all of them. So I apologize in advance for that one. So I'm just going to try to pick a couple for our panelists that are apropos of things that we talked about. And so actually, I'm going to direct the first one to you, Renee, because this is very apropos of what you just talked about. One of the questions is somebody who wants a second opinion but doesn't want to insult their doctor.
Ooh,
What should they
okay.
do?
I had like third, fourth, fifth, sixth, seventh. Um, well, yeah, it is a little tough. I think the hardest thing is if you're already in a medical center, there's a lot of things here because it depends on your insurance. Will they let you see a second person? If you're in the same medical center, in the same practice, they probably won't let you see somebody else in the practice because they're in the same practice. So in my case, I live in the Chicago area. There are 5 medical centers. I've been to all of them. And I think if you are lucky enough to be in an area that has more than one medical center available to you, or you have the means to travel. Like I was able to, I actually flew one day down to Louisville because I saw a dermatologist there after the one here was messing me up, because I knew he was an expert. I also went out to Hopkins and had that evaluation. So um, it's hard, but I don't know that you have to tell the doctor. The only thing is if you have to get your records to bring them over, you might have to say you just need continuing of care. They usually want you to do a release, and you have to say what the reason is you want your records, and you just say continuation of care. Some people would go to the Mayo Clinic or someplace else. I think you shouldn't feel badly about it. You're the patient. You need to get the help you need. And if you insult your doctor, then they're not the doctor for you anyway, is the way I would look at it.
I'll completely agree with that. Yes. I mean, a doctor who gets upset because you're getting a second opinion, you need a new doctor.
Mhm.
Yeah, I'm
Yep.
with you on that one. Thank you. I want to ask a question for Jen. There's a question in the chat here because it's apropos of what you talked about. You recommended that patients go to a myositis center, that you thought that that was a darn good idea. One of the questions is, okay, how do I get in? Because it's really hard sometimes to get in. So do you have any advice for how to get into one of these centers? And you also mentioned you've got a little 30-second story you'd like to tell, which would be great.
Oh yeah. So to get into a myositis center, like I said, I got really lucky in that there was a relationship with the physician that I saw, the rheumatologist. So what I would say is the more you talk about it, the more you can network, and you just never know. The other huge thing for me was when I went to TMA in San Diego, there was a lot of ways to be able to kind of get in touch with the myositis centers and know where the local ones are. For example, I think one of the things that the chat was asking about dermatology, I had no idea as a PA practicing over a decade that there was such thing as a dermatologist, rheumatologist, dual board certified, which is what has helped me significantly with my skin stuff because they just know it better than anybody. So I'd say network, ask any of physicians that are taking care of you if they happen to have any colleagues that know anybody, and then just get on that wait list that's usually 6 to 9 months and you'll get in. But in the meantime, you might be able to get yourself in a little bit faster. The story, and that goes along the same lines I was saying, is that just talk to any when you're getting your scans done. It's the ultrasound tech, it's the MA that you're talking to. Let them know what your condition is and give them a little 10-second elevator pitch of what it is, because you're informing them. I can't tell you how many people I've told like that didn't know about my how I'm increased risk for cancer for TIF1 gamma. So much so that now all of my colleagues in the ER, it was really cute. One of them says I'm never allowed to tell this story, but he had a patient in there, couldn't get up, but was having dysphagia, lots of symptoms, didn't know how and what to do, went to Chat GPT, put the symptoms in. Chat GPT said this could be dermato, and he goes, oh my gosh, Jen. And then he said so he went ahead and checked the CK level, and it was through the roof. And he's like, he came to me, he's like, I diagnosed dermato in the ER, which is like, I'm like, that person just like took 2 years off of their diagnosis. You know how long it takes to get diagnosed, and you did it as an ER doctor, and high five. So
But I don't think you're recommending that we use ChatGPT instead of C.
no, that's what
No,
he was
I don't.
embarrassed
I
about.
wouldn't
He's like,
recommend
all that medical training. He's like, and Chat GPT is the one
it.
that gave me the differential. I was like, yeah, I won't tell anybody except the whole world.
Thank you. Great story.
Yeah.
Barbara, yeah, you comment?
I wanted to say that I think one way to get in is to be friendly with the nurses. Speak up for the nurses in the clinics. These clinics are hard to get into. If you make yourself in a very nice way known to them, sometimes there are things that they can do. Like I had to say, I'm really getting worse here. I'm really scared. And they got me in. But I think just, making those connections with people, like making yourself known, can really be helpful if you need to get seen earlier or you want to be seen earlier.
I think that's great. A great insight. Absolutely. Thank you. There's a question here that's specifically for Jim Maloney. So, Jim, the question is basically if you're looking for a physical therapist, I'm paraphrasing, if you're looking for a physical therapist, how do you get a good one? And by good one,
Yeah.
meaning somebody who knows something about myositis.
Yeah.
In this case, yeah.
Well, in general, good luck, because it's not necessarily part of our training. We bump into it somewhere, and then I would say most PTs, OTs, and speech therapists, when they are confronted with a new diagnosis, they usually dig in. So realize that it is very difficult. So one is I would lean on your support groups. I would lean on, I think the TMA on the website actually has a link to the APTA's website that actually has PT Source. So you can actually look for specifically trained, and I would say trained is a neuro certified specialist. That is probably closer to the diagnosis. They might have had an exposure or an experience. The next one would be a geriatric certified specialist too. Those would probably be your two biggest options. It is word of mouth, and it is something that, say you are being treated in a myositis center that has a rehab staff. A lot of times they can connect you to somebody local. And or if you're being treated by, let's just say, like a local neurologist or rheumatologist, they often have connections in some of their communities or within their system that have exposure and understanding of myositis. So there are resources. Again, to that point, we're informed consumers. We sometimes have to do a little bit of work to maybe identify them. And I would say those also in therapy, I would encourage people to get a second opinion sometimes. If you don't feel you fit with that individual, you need to find the person that you fit with. And they might have the knowledge and the wisdom to provide you really good care, but they just might not gel with you. That's okay. You can look to other resources.
Thank you. Two brief comments. I know Jim Matthews, you wanted to say something too. My personal experience, I went through at least 3 physical therapists before I found somebody who I felt that really kind of knew where we were with it. And I'm in the field, and it took me a while to find somebody who would work with that. And the other, I want to echo a comment that Paula made in the chat there, which is that your local support groups can be a very valuable resource for finding physical therapists and other healthcare providers who are knowledgeable about myositis in your area. So if you're not a member of a local support group, you may want to consider that because of that kind of local knowledge there. Jim Matthews, you had a comment?
Yeah, actually, back when Renee and I were both on the board, we kind of took it on together to maybe get into the physical therapy schools and give a presentation, which I have done once. I should do it more often. I've got a good one that's only 20 miles away. So, because it's my contention, and I remember Renee's too, physical therapists sometimes are the first people to really see and figure out what's going on, because you go to your family doctor and you're saying, well, I'm having trouble going upstairs, I'm tripping, I'm falling, I'm doing all these things. And I think it's very reasonable that family practitioner would say, I'm going to get you to a physical therapist. So I think it happens fairly frequently that a physical therapist is the first one to actually see your symptoms. And again, I'm talking more about IBM, but it really is about all the different forms. So I think I'm going to call the local physical therapy school again and offer to come and speak, and not to speak as an expert, just to speak as, here I am, I'm a patient. This is what you may see. I'm typical, okay?
I think that's a great idea, and not only for PT but for medical schools. I mean, there's opportunities for us as patients to participate in the training of the next generation of healthcare providers. And I think if those opportunities are available, we should certainly take them. Barbara.
Yeah, that's what I'm doing now at the university that I work with in interprofessional training. And it's been a real eye opener for me and for them. It was really, really helpful. So I think that's one way we can be positive and move things forward, hopefully.
Yeah,
Same here in Southern California. Yeah.
Yeah, that's absolutely great. Jim Milani, did you have
I
a
was just going to comment, you guys are talking about continuing education for educating OTs, PTs, speech therapists. We actually had TMA sponsored one yesterday, last night, which I actually was part of here in Colorado. So we had a handful of PTs and OTs that we empowered and equipped with an understanding of myositis, with the focus of bringing awareness. And I did get feedback from one of them in particular who's going to take it back to her hospital system to meet with her rehab team to talk about the specifics of these, this population exists and we sometimes miss them, with regard to diagnosis and kind of the things we need to do to get them in the system and get them treated the right way.
Thank you all. We're nearing the end of time, but what I want to do, I'm going to squeeze two things in here, um, because there's a question in there I really want to address, which is about clinical trials and how do you find them. And so I'm just going to very briefly say clinicaltrials.gov. That's the place to find them. And then you contact the clinical trial site yourself. You don't have to do it through your doctor's office. Sometimes they can help, but you're often better to just go after it yourself. So yeah, thank you very much, Rachel, for putting that in the chat. So I saw that one go by. I participated in a clinical trial. I think it's a great opportunity to be have the opportunity potentially to try some therapies as they're being developed. And the other one here was that I wanted everyone to address just like 30 seconds each because we're running close on time. But it was a question from a medical student who has been recently diagnosed with dermatomyositis. And she's wondering, I think it's a she, excuse me. She's wondering how she's going to be able to manage the workload involved in medical training while she's dealing with her dermatomyositis. So we've all had to deal with our own work lives and efforts in so many ways. So just like 30 seconds, if you got any advice for her. Renee, I saw you raise your hand.
Well, I feel for he or she. I had just finished my training, but I was full-time in a medical center, new baby, just moved here, didn't know a soul. So I think first and foremost, you can't learn anything. You can't be an effective medical student unless you take care of yourself. And if it means that you have to take a break, whether it's a month, 6 months, a year, you have to get yourself better because you can't possibly be an effective learner if you're, I mean, there's brain fog sometimes because of the myositis, because of the meds, both. Obviously, if you have difficulty just maneuvering, depending on where you are in your year, if you're doing more physical things where you actually have to, move a patient or do an exam and you have to move your arms. I mean, I couldn't pick my arms up over my head. So there's a lot of things I wouldn't have been able to do. I couldn't get out of a chair. So I had to take some time off, obviously, because I couldn't see patients. And it's a little different because I was done, but it's the same kind of idea. So number one, it's like they say in the airplane, if you're with someone, put your oxygen mask on first before you help others. If you don't help yourself, you're not going to be effective for anybody else. So that would be my recommendation. Hopefully you have an understanding medical school staff.
Jen, I'm going to let you have the last word. We're running
Of
from right
course.
at the end of time here. Yeah, go ahead.
No worries. Because I've just, same thing as Renee, and I've gone through this and, take care of PA students on their clinical rotations is number one, I would seek to see if there is, other than taking a break, see if there's accommodations of either a telemedicine rotation or whatever rotation you're able to do. Grab a stool whenever you can, prop your arm up on things so that way it's not shaky. And then the other thing that somebody recommended, because the fatigue is so bad, is speak to your providers about if there's any medications that may be able to help combat that or help supplement that for times that are a little bit harder for you. Yeah.
Thank you very much. Thank you all very much. Great panel, great stuff. I learned some stuff from this, so it was really terrific. So a tremendous thank you to our panelists for their time and being willing to share their own stories, with each other and with all of you. So I really, really appreciate that. A huge shout out to the Myositis Association for arranging this and for giving us the venue and the opportunity to talk about this. And the Myositis Association has been just so incredibly helpful to me in my own journey, and so I encourage you to make use of the resources there to become a member. And that it's just been so helpful. I found them personally so helpful, and I think you will as well. Speaking of which, tomorrow, May 30th, there is a TMA's Diagnosis Day for polymyositis and overlap myositis. And so there's an Ask the Expert session as well as a cafe chat social hour. And those are both tomorrow. If you go to the TMA website calendar page, you can register for those. So I want to make you all aware of that as we reach the end of myositis month. And let me close then with a thank you to Rachel for arranging all this, Paula for keeping herding all of the various cats of everything, keeping the Myositis Association going. And so really appreciate that, and a huge thank you out to the audience for being here this evening. So thank you all very much, and enjoy the evening.